Alix Fox here, your sexpert at Superdrug. It's my job to give you the lowdown on your down belows. So today I'm going to be taking you through the what and the why of 3 common STIs. To kick off, let's deal with the most difficult to spell of all sexually transmitted infections, gonorrhea. Gonorrhea can be passed on through unprotected vaginal, anal or oral sex. Gonorrhea bacteria can infect the cervix, that's the entrance to the womb, the urethra, aka your pee pipe, the rectum, your botty hole, and they can even find a natural habitat in your throat or your eyes. Symptoms of gonorrhea can include a delightful, thick green or yellow discharge that comes out of the vagina or the penis. It might hurt when you go for a wee, and in women you might experience some bleeding in between periods. However, around 1 in 10 infected men and about half of women with gonorrhea show no symptoms at all. Nothing, nada, zip. The good news is, though, that it's quite easy to treat. You can sort it out with just 1 antibiotic injection and 1 antibiotic tablet. Bang! And the gonorrhea is gone. I always think that chlamydia sounds like quite a posh young girl's name. Yoo-hoo! Chlamydia, darling! Unfortunately, it's another STI. Chlamydia is one of the most common STIs in the UK, and again, it's passed on from one person to another through unprotected sex. By the way, there doesn't have to actually be any penetration or ejaculation for chlamydia to be passed on from one person to another. If your genitals are touching, or if you touch someone's genitals and then even touch your eye, if you've got bodily fluids on your fingers, that's enough for chlamydia to invade. Symptoms-wise, well, you might notice some discharge coming out of the vagina, the penis or the rectum. You may experience bleeding in between periods or after sex. It might hurt a bit when you go for a wee, and some guys notice that their testicles swell up. But for the majority of people, yet again, there are no signs. Thankfully, chlamydia can be dealt with using our friends, antibiotics. Your treatment options include going to your GP, popping to a sexual health clinic, or getting some help from Superdrug's online doctor. Finally, I want to chat about herpes, which can affect her and him and everyone. It's really easily transferred between people, either during sex or just through skin-to-skin contact. However, it is easier to catch from somebody if they're showing symptoms, and these are small little blisters or cold sores either around the oral region, around your mouth, or in the genital area. Once the herpes virus has taken up residence in your body, it is there for life, but for a lot of people it doesn't cause problems. For those folks who do get future outbreaks of blisters, then your doctor can help by giving you antiviral medication that can help dry them out and heal them faster, and they can also give you a cream to help with the pain. One really vital thing to know about herpes is if you're someone who is a carrier and you get blisters now and again, when you feel that tingle that kind of gives you a clue that there's an episode coming on, or if you spot that you do have blisters or sores, please don't have sex during that time, as it's really easy for you to pass it on to someone else. Some of you watching this video might be wondering whether you've got an STI, and perhaps you've been ducking out of going for a test. Well, you should know that knowing your STI status can be really empowering. It allows you to take care of yourself and to take care of other people. If you've got more questions, there's loads more in-depth advice and information on the online doctor service as well. But for now, my transmission on sexually transmitted infections is done. See you soon.